Welcome to On Call with Dr. Anselm Anyoha. Today we're talking about a condition that shows up quietly, looks dramatic, and sends many new parents straight to the mirror, the internet, and sometimes mild panic. Cradle cap. Cradle cap, also called infantile seborrheic dermatitis, appears as scaly, crusty patches on a baby's scalp. Parents may notice yellowish or whitish flakes, areas that look greasy, mild redness, or even spots where the hair seems thinner or clumped together. It often looks worse than it is, and that's important because cradle cap is not dangerous, not painful, not contagious, and not a sign that anything has gone wrong. In this episode, we'll walk through what cradle cap is, why it happens, how parents usually respond, what pediatricians recommend, and when it's time to take a closer look.
Dr. Anyoha, when parents first notice cradle cap, they often worry they're seeing a rash or infection. What exactly is cradle cap, and how does it usually present?
That's a very common concern, and it makes sense. Cradle cap typically appears between 3 weeks and 6 months of age, right when parents are still learning every inch of their baby. Most often, parents notice scaly or crusty patches on the scalp, especially near the hairline, eyebrows, or the soft spot. The scales may look greasy and yellow, or dry and flaky, depending on the baby. In babies with darker skin tones, the color contrast may be subtle, so parents often notice changes in texture rather than color, rough patches, thicker areas, or hair that grows unevenly. What's interesting is that many parents don't bring it up during routine visits. Pediatricians often spot it during an exam and reassure families that it's common, expected, and usually temporary.
Parents often ask, why did this happen? Do we know what causes cradle cap?
We don't have one single cause, but we do have good explanations. Cradle cap is thought to be related to overactive oil glands in the baby's scalp, a naturally occurring yeast called malassezia, which thrives in oily skin, hormonal influences from pregnancy, which can temporarily stimulate oil production in newborns. What's crucial for parents to hear, sometimes more than once, is what cradle cap is not caused by. It is not due to poor hygiene, not an allergy, not an infection, and not parental neglect. Babies with excellent care get cradle cap. Babies with less frequent baths get cradle cap. It's part of early skin adjustment.
Once parents notice cradle cap, many start experimenting at home. How do parents usually manage it, and what's considered safe?
Most parents begin with gentle home care, and that's usually the right place to start. Common approaches include applying mineral oil, baby oil, or petroleum jelly to soften the scales, washing the scalp with a gentle baby shampoo, using a soft brush or fine comb to loosen flakes after washing. These methods are safe when done gently. The goal is to soften and release, not to scrape or force. One thing I always emphasize is patience. Pulling scales off aggressively can irritate the skin, cause small cuts, and actually make things worse. This is slow work, like convincing a baby to sleep, not negotiating a hostage release.
At what point do pediatricians step in, and what treatments do you usually recommend?
The first and most important step is reassurance. Cradle cap is benign and self-limited. For mild cases, pediatricians usually recommend applying oil to the scalp for a few hours, washing with baby shampoo, gently combing out loosened flakes. If cradle cap is more persistent, thick, or inflamed, we may recommend medicated shampoos, often with antifungal properties, short courses of low-strength hydrocortisone cream to calm inflammation. These treatments are effective, but should always be used under medical guidance, especially in young infants.
When should parents stop managing cradle cap at home and seek medical advice?
Parents should contact their pediatrician if cradle cap spreads beyond the scalp to the face, neck, or body. The skin becomes very red, swollen, or starts oozing. there is significant or patchy hair loss. The condition doesn't improve with gentle home care. In those cases, we want to rule out other skin conditions, such as eczema or fungal infections, and adjust treatment if needed. Cradle cap is common, harmless, and temporary. It may look dramatic, but it does not hurt the baby and does not reflect poor care. Gentle daily care, softening scales with oil, washing with baby shampoo, and careful combing is usually enough. Most babies outgrow cradle cap within weeks to months, and the scalp returns to normal. Parents should remember this: cradle cap is a cosmetic issue, not a medical emergency. With patience, reassurance, and a soft brush, it passes. Thank you for joining me on Call with Dr. Anselm Anyoha. If you found this episode helpful, please share it with friends and family.